Right, take.
I'm doing it. I'm going to do it again.
I can't do it at the same time. Let's try doing that.
Yeah, okay.
Take. Right, we're really lucky to have Faisal, who is a absolute superstar, and in the world of musculoskeletal stuff, everything you need. And you're a specialist, aren't you, in that area?
Training to be, yes. Wow.
Do you want to tell me about your specialism?
Yeah, sure. I'm a GP, and I have a specialist interest in musculoskeletal medicine. And I'm also training to be a sports and exercise medicine doctor.
Perfect. So thank you so much for coming along today. I wonder if we could pick your brain about something that we see an awful lot of, back pain. Would you mind just talking us through your thoughts on back pain, and maybe we can get some top tips from you later on?
Sure. I mean, where do you start, topic. Isn't it?
It's really common, isn't it? So if we start with, there's acute and chronic back pain, isn't there? Mm-hmm. So acute as in short, something that hasn't been around for a long time. I wonder if that might be an area for us to talk about today. So people who have some sort of injury and injure their back and they're not quite sure whether to go to the hospital because the pain is really bad and severe, and whether they go to the GP, whether they go to the pharmacy, what they can do, that sort of stuff. So how do you decide as a patient what you need to do?
That's a good point. And I think just on the point that you made earlier on about back pain being so common, one of the things that I've learned is that back pain is amazingly common, but it's also common across all age groups and all types of patients. So I've seen back pain in, for example, 12-year-old children, all the way up to 90-year-old patients. And I've seen them in people who perhaps are not very active at all and they have lots of medical problems. And I've seen them in elite athletes working at sort of GB athletics levels, for example. And
GB is for Great Britain, for the people watching abroad.
That's right. So like international level sport, those athletes have back pain, and then people are not active at all have back pain. And it's just really fascinating to see that back pain is common across the board.
That is interesting, actually.
All ages, all backgrounds. It's just there. It's really, really common. And that should sort of...
Why is that? Have you got any...
Well... So people have put up some theories about the commonness of back pain or the incidence of it. They found some archaeological specimens of sort of ancient humans, and they found back pain and wear and tear in the spines of these archaeological human ancestors. And the argument is that back pain is the price we pay for an erect posture.
Oh, I see. Yeah.
Now, whether animals who are on 4 feet get less back pain is an interesting question, because we can't actually ask animals. But it seems like there is less of a back problem.
But presumably you can see animals' skeleton and vertebrae and stuff, so you can... From a wear and tear perspective of the bones, do animals have back pain as well?
So I'm not aware of any comparative studies from other animals which are erect, like, for example, ancient dinosaurs or kangaroos, etc. We don't have enough evidence. But what we do know is that back pain is very old, and it's been around for millennia, and it's there even now. So yeah, it's an interesting and fascinating topic. And as you said, it's quite a anxiety-provoking one as well. And that's part of the human defense mechanism, because typically if you injure something which is very close to your spine, it's a bit more scary by its very nature. And if you look at other animals, if you pat a horse on its back, a wild animal on its back, it thinks it's a threat.
Oh, really?
Yes, so one of the things that horse riders or horse tamers have to do is to train the horse to have somebody on its back because it's actually a very unnatural position for a wild animal to have constant sense of a sensation on the back. And similarly for us, from an evolutionary biological perspective, if you get pain somewhere in your back, that's actually quite scary on an evolutionary, biological, physiological level. So it's understandable that it's a very scary position to be in. But then thankfully we have the conscious mind and you can think. And it's really important to recognize that back pain is absolutely common. So almost, if I remember the study correctly, about 60 to 70% of people will experience some kind of back pain in the course of their lives. And this is sort of the human population, as it were. So it's amazingly common, and it's amazingly scary when you get it, particularly. But the good news is that almost the largest proportion, 90% plus of back pain is innocent. It's not serious, and it will resolve by itself even if you did nothing to it within its time frame. And every person has a different time frame, and that depends on multiple factors, too many to go into now. But generally, it's about sort of between 2 weeks and 3 months.
It's quite a long time, though, with, when you can't move and you can't go to work, and it's
Oh, of course,
So it's at that point in time, if you were to say, you'll be fine in 2 weeks, it doesn't make you feel very happy, does it?
No, and it's a spanner in the works, isn't it, back pain? Typically it happens when you're in the middle of something, you're having a house move, classic one, house move, or going out on a much wanted holiday, going on a hiking trip with the children, or something important, and it has to come at that time. And then when you're told at that moment is, well, it'll get better by itself in a couple of weeks, then actually those 2 weeks or those 3 weeks sound like aeons of time. So it is a nuisance. And this is why sort of looking after your health and reducing your risk for getting back pain is actually quite important.
What sort of risk factors?
There are several. So the literature talks about your general fitness and your general health. So how much aerobic activity you do or are able to do. So people, for example, who regularly cycle, regularly walk, regularly run, or do something aerobic, their muscles tend to be better conditioned. People who do some basic weights training, so I'm not talking about sort of pumping iron in the gym, but it's more like body weight training, a bit of Pilates, for example, or just some strength and conditioning work, body weights is enough, will further reduce their chance of getting back pain. People who do exercises with an element of balance involved, so things exercises that involve standing on one leg, or swimming, for example, front crawl swimming is a really good one. That will reduce improve the chances of you not getting back pain. Further on, there is other things like looking after your diet, drinking plenty of water, having the micronutrients, so there is enough inflammation control in your spine. And last but not the least, managing your mental health. It's actually really important because when we get stressed, our muscles naturally become tight. And if you already have an area of weakness, biomechanically speaking, then it puts you at risk of getting back pain in that area.
And again, going back to what you said earlier about when you least want it, and actually when you are stressed is the last...
Classic, isn't it? And another aspect of back pain, or reducing the risk of your back pain, is what we call in sports medicine the 10% rule. So in general, whatever activity you do this week should not be more than 10% in its severity, intensity, and frequency to what you did last week. Now, this is not a hard and fast rule. Everybody's body is built slightly differently. For some people can tolerate 20%, some can tolerate only 5%. But the point is that if you're going to do something this week, if you're going to go into a house move, it might be a good idea to train yourself up for the few months or weeks beforehand so that you're in a better position to be able to lift the weights and do the shifting, etc. Now, easier said than done, I accept, but a big problem is when the amount of load you put through your body suddenly changes and your body wasn't prepared for that.
That is such a good tip. Honestly, it's such a good tip because, like, for me, we were talking earlier about the fact that I plan to go to the gym, but I haven't been. And if I were to go back, I would try to do what I did 10 years ago. And, you know, that is such a good bit of advice, actually. And I've seen loads of patients who start exercising because of an event or something happens. Maybe perhaps there's a bereavement or they've recently been diagnosed with something, and then they overexert themselves and they're out of action, and then they're less likely to do it again in the future. So
absolutely, I think what you've touched upon is a slightly different but a very important point, and that is people forget what they're like physically now. They remember a time in the past where they were perhaps at the peak of their health, or perhaps not. But the point was they remember something that's not now, and then they expect that if they've had a significantly long break, then they can just go back to what they were doing before. My usual advice in this regard is that if you've had a break, so let's say you were playing, I don't know, you're playing football once a week, and you're going to the gym twice a week, and you carried this on for 20 years, and then you took a 3-month break. My usual advice from this is when you go back, drop everything to about 50% and then build up steadily, which is much safer way, I think, than sort of just going back to where you started. And
the other way you can work out what you look like in reality is by having a camera focused on you, which automatically adds an extra couple of chins. But yeah, so thanks for that. That 10% rule I hadn't heard of before. So and it kind of 10 or 20% you mentioned. So it makes a lot of sense, and it's sort of building things up. If you get back pain, like, how do you decide where you need to go? Do you go to A&E, or do you go to the GP the next day? Do you call 111, or do you go to the pharmacy?
That's a good question, and I think it's a tricky one, isn't it? Because we've had patients who should have gone to A&E, and then they're just sitting at home, and then we've had patients who actually needed 2 paracetamols and they've gone to A&E, and it's a really hard one to know. I think, as a general rule of thumb, if you're experiencing a symptom, if you're experiencing back pain, particularly if it's acute, the important thing to do is to get help. That's really important. But then what's also important is to follow the help that you've been given. So I don't know if this is your experience as well, but this happens to me often, where patients experience pain, back pain. They call up 111, for example, or they go and see their GP, and then they are given advice, they're examined, they're given advice, and they're told that this would take 6 to 8 weeks, or however much time it would take. They're given some exercises to do, and then because the pain hasn't improved to the required expectation, up to their expectation, they then start seeking help and start escalating it. And I think that is really a much more of a challenging situation to be in, both for the patients and for the clinicians, than it would be for if you've experienced pain, you didn't know what to do, and then you called 999 and then ambulance came and took you. I don't think that's a problem, because if you genuinely perceive that you need to be seen in A&E, then you need to be seen in A&E. But the challenge, the difficulty I think happens is when you've been seen in A&E and A&E have discharged you with a bit of paracetamol or cocodamol or something relatively trivial, oftentimes patients feel that they've been ignored rather than reassured.
Yeah.
And I think that is where the mismatch between how much pain you experience and what the doctor's telling you doesn't quite compute, because you're in a lot of pain and they're telling you everything's going to be fine. And I see why. And they're telling you without having done an MRI scan. Oh yes, that's another good question.
Talking through MRI scans?
Absolutely. So allow me to explain. So everybody knows that scans, X-rays, MRI, CT scans can show us a lot. But what a lot of people don't realize is that they also don't show us a lot. There's some conditions or some causes for pain that scans can't show. For example, muscle spasm. We were talking about muscle spasm earlier on. There isn't a scan in the world that can show you a muscle spasm. Also, biomechanical forces that, the forces of physics in your body, which is kind of hard to explain really. But if a certain tissue is undergoing stress, a scan won't be able to show it because it's just not designed for that. Thirdly, scans don't show you what you're doing when you're moving. So when you're standing, walking, bending, climbing stairs, scans can't show you that. They can only show you what's where. And finally, scan can only show you the structure of a tissue. It can't show you which tissue is sore, for example. And we assume that, this one looks a bit worn, therefore it must be sore. That's an assumption we make. But actually, I've seen it many times where there is a piece of bone which is completely worn off, but it's completely pain-free, and there is something further up which is the source of pain, but actually looks fine on a scan. So scans give us a lot of information for the right reasons. If you do it for the right reasons and you do it with the right knowledge, then they're amazingly useful. But for majority of the times, for most people, you don't need a scan. And most doctors, even nurses and physiotherapists, are trained to identify the medical emergencies that are associated with back pain, the ones which are require to have an operation very quickly. You've heard of cauda equina syndrome, for example.
Would you mind, can I just, before we go on to that, I just want to say thank you for that beautiful explanation. It makes a lot of sense, and it kind of, because sometimes I think patients feel as though they haven't, being poked and prodded a bit and asked to move around a little bit, they don't really feel that they've got to the source of the problem, and you're right about being dismissed, and so visually they want to see something, but that's like a perfect explanation. That's really helpful.
Oh, thank you.
So the medical emergency then, for what is the one thing that, what is cauda equina and how is that an emergency?
It's a good question. So everybody knows that there are discs in the spine, right?
Not everybody knows, actually. Would you mind?
Oh, okay.
Would you mind just...
I wish I had a model, actually.
We'll put one in after.
Yeah, that'd be nice, actually, yeah. So in your spine, there are many structures. Some of them are bones, some of them are muscles, some of them are nerves, some of them are ligaments, tendons. And then between your bones, there is this donut-like structure called a disc. There's a lot of talk around discs and what discs do and what discs don't. I don't want to go into too much detail, but suffice to say that sometimes a disc can press on a nearby tissue, like it could press on a nearby joint, or press on a nearby nerve, etc. If a disc starts to press on all of the nerves of the spinal cord that go into the canal that's behind the spinal cord protects the spine, protects the spinal cord, which is the extension of the brain, essentially. And it has all the nerves that you need to move your legs and your hands, etc. And if the disc starts to press on those nerves, or all of those nerves, then that can become a bit of an emergency, because now you have all the nerves below a certain level which are completely blocked off. And if you don't remove that pressure, if you don't release that pressure, it could end up with you in a wheelchair, or worse. And the good news in that is that this condition known as cauda equina syndrome, which by the way is Latin for horse's tail, because the nerves coming out of the spine look a bit like a bushy horse's tail and when you look at them on an MRI, but that's by the by. The cauda equina syndrome is amazingly rare, and actually the deciding quality, or the thing that doctors and nurses and everybody looks for in cauda equina is not back pain. It's actually symptoms in the other parts of the lower parts of your body. So for example, if you have a loss of sensation in your private parts, everybody has normal sensation in the private parts. If you lose that normal sensation, then that's a sign that we think about, we look for. If you suddenly become incontinent without realizing it.
Incontinent as in unable
as in
to...
you have accidents with your urine or with your bowels. So some books say that bowel incontinence is more typical, but I've seen cauda equina with both. Okay. So the point is that if you, and it's not having difficulty passing urine. That's one issue. It's not that I have to go again and again. No, it's when you've passed urine and you haven't realized that you've passed urine.
Okay.
Because ultimately it's a loss of sensation. The nerve has been blocked. It's not passing sensation down. It's not passing sensation up. Nothing's going down. Nothing's coming up. So that area is effectively paralyzed if you think about it.
And the same for the fecal incontinence.
And same for the bowels.
You don't realize that
you've done it, and you either smell it or you see it, and something's happened. And so it's quite rare, as you could imagine. Or if you experience bilateral weakness in both of your legs.
Okay. At the same time.
At the same time.
Okay.
Right.
And would that be sudden?
Relatively sudden, unless it could be over a few hours. It could be over a few days or weeks as well. So it can, everybody's slightly different. But the point is, if you have a progressive weakness in both legs over time, then that is a pretty good sign that something might be on. Now, not everybody is a medical professional. And for those viewers who are listening to this, I think it's important to recognize that if you have something in your private parts or in both your legs at the same time and you have back pain, tell your doctor. I mean, most of us are qualified. I mean, we train in this, don't we?
It's quite an embarrassing thing to talk about, though, isn't it?
Yes, and that's why it's so important to talk about it. If you don't mention it, I mean, most doctors will ask. I always ask, but if you don't mention it, then it can be a bit of a problem. Or if you lie about it.
And the treatment for cauda equina?
So if you have, surprisingly, not all cauda equina needs an operation, just so you know. But majority of the times when it comes in an acute setting, the way we're describing it, there's an operation that you can do that can effectively make the chances of any kind of sequela practically zero. So it's an operation. I'm not going to sort of undermine that. But it can make you better. It can save your life in a wheelchair.
So listening to this could save your life.
Possibly.
You never know. Right. Quick fire questions then.
Sure.
For back pain questions. Let me think. Back pain. What sort of painkillers should we start with?
The best painkiller is no painkillers. But if you must take something, then take something to help you move more, not because it's hurting. The more you move, the movement will solve the pain. The painkillers are only there to help you move.
Okay. Which leads on to another common question, actually, is I don't want to take painkillers for my back pain because it will numb the pain and it will mask my symptoms. Is that true or false?
Yes and no. So I think, as I said sort of a short while ago, you need to take some painkillers sometimes to allow you to move.
Right.
So long as you are moving, then the movement will help your back pain. So if the painkillers numb the pain a little bit, then that's absolutely fine. But if you genuinely have back pain, you might notice that no amount of painkillers will actually completely take the pain away anyway. And you can't numb it to make it worse. The spine is a very strong structure. It has carried your body weight for the entirety of your life. Unless you're going to jump off a building or something dramatic like that, it's not going to suddenly just crack and break into half just because you moved awkwardly. Yeah. So I don't think there is a painkiller dose that can suddenly just numb it all and put you at harm's risk.
Can you take paracetamol and ibuprofen? Or can you not take them together?
So for those people who don't have any side effects or contraindications, allergies, etc., to ibuprofen, paracetamol, there's no reason why they can't take it together. Although I would recommend not taking any ibuprofen-like medicines for more than 2 weeks at a stretch for the safety reasons that you know about.
And asthma as well, and it can upset your tummy sometimes.
It can upset your stomach, it can give you asthma. And perhaps more importantly, though, from my perspective, if your back pain is related to some kind of inflammation or a sprain, for example, then having an ibuprofen-like drug inside can slow down or reduce the quality of the healing. Remember, some of this pain is there because the body's trying to heal it, and ibuprofen can interfere with that also. So it's useful to be judicious with them.
Myth or fact? Should you have bed rest or mobilise, move around?
Absolutely mobilize. Absolutely mobilize.
Because in the olden days, you say, oh, bed rest for a couple of weeks.
Yes, that is true.
So is that an old wives' tale?
It's not an old wives' tale. It's actually what medical science used to suggest back in the 1800s and onwards. And it's a legacy of rest, really. We didn't understand much about the spine back then. We didn't really know what we were doing, I think. So the treatment for back pain was complete bed rest for 3 to 6 months sometimes.
Wow.
And a lot of people have come out of it with rigid spines and lifelong suffering and pain. So I think what we understand about the spine now, and generally about most of the human organism, the human body, is that it was built to move. And putting it to complete rest is rarely a good idea. Even with some fractures nowadays, we're trying to have some movement. So not, obviously, not sort of full movement, but micro movements. So I think it's important to have, with back pain, we must move as much as your pain allows you to. And, obviously by moving, I don't mean go on long walks and start lifting heavy things, but keeping moving is absolutely crucial.
Top tips for exercise for back pain?
The best thing is to do what you are able to do within a certain limit of pain. It will always be somewhat uncomfortable, but it shouldn't be very painful. Most patients prefer stretches.
So what is a stretch?
So just gentle ways of stretching your spine. So bending forwards gently, bending backwards, bending to the right.
Without any weights or anything?
Without any weights or load or anything like that. And just as much as your pain allows you to. Stretching your hips, stretching your back. If you're not sure, you can speak to a professional and they'll give you advice. But interestingly enough, some other patients prefer doing aerobic activities which help their back pain. So, example, going on a cycling session or doing a little bit of swimming, for example, that can help the back pain as well.
And actually, it's what you said earlier about your whole body being connected, and doing any form of exercise strengthens the back. Because it joins everything together, doesn't it?
Absolutely.
Thank you very much.
No bother.
Faisal. That was really insightful.